Well, we've come to the end of our workshop, and what I'd like to do is just provide a few concluding remarks. I think you all have begun in that process of considering what these important concluding remarks are. So let me try to integrate a couple of them. First, epigenetics is just one approach to understand this dynamic interaction between genetics, environment, and childhood development that affects childhood obesity and potentially offers us insights into periods of potential reversibility and prevention. The second is that we need to, one, assess epigenetic variation in the context of genetic variation. You heard Rob Waterland say that yesterday. You heard Caroline Relton echo that today. And focus on the genome regions with inter-individual variation. The second is we need to be clear about how this science can benefit society. Are we about shedding light on causal mechanistic pathways, developing predictive biomarkers such as the RX-R-alpha that you heard Karen Lillycrop talk about yesterday for diseases or intervention response, or a bit of both? Because our approach, depending on our goal, should be different. Now, that means also this interesting dialogue that you've heard about what is the right tissue when examining these questions. And the answers should be different depending on what the question is, causal pathway or biomarker, and how these things are related. So the third is how we want to include and assess transgenerational influences. What is meaningful? What is practical? The fourth is that we need to examine the technology. So you've heard methylation, and I think Rob set us up really well at the beginning of yesterday, mentioning that methylation is merely one way to understand epigenetics, and epigenetics is merely one way of understanding developmental programming. So we have to understand what is the right technology. What can it tell us, and what can't it tell us as we're interpreting the data? For example, methylation tells us quite a lot about this one epigenetic mechanism. However, the current technology is predominantly enriching promoter regions, and now we know enhancer regions and intergenic regions are just as important. We might also need to consider that as we are working with animal models, maybe methylation isn't the best approach. Maybe it is the microRNA. Mark Vickers will tell you that it's easier to create a knockout model for microRNA than it is to create a knockout model for methylation. We need to be really intentional about creating models that we think will have the greatest opportunity for translation into people. And as Matt presented, going backwards, what we learn from people back into our animal models. I really like this next point that I think you heard echoed, which is we need more tools to understand this type of complexity. The next point that I wanted to emphasize is that it's likely that we are seeing the result of a cascade of factors that have been set in motion generations ago. And epigenetic research is a tool to discover where and when to intervene to prevent this metabolic dysfunction and immune dysfunction and potentially identify what can be reversed. But which marks are in ink, as Andrea Baccarelli mentioned yesterday, and which marks are in pencil? And when are these marks being made? The next point I think to highlight is that the opportunity is vast, especially given that currently we have remarkable momentum around big data. So you're hearing words like big data and precision medicine. How can we see that as an opportunity to better answer the questions that have been posed over this day and a half? That means things like developing systematic data elements, perhaps standard protocols, and how we're incorporating them across all these cohort and longitudinal trials across the globe. And it's not the impossible things. I think we have to start with simple and compelling, like maternal and paternal birth weight. We need to include in these databases how we link to tissues. This is clearly already an ongoing momentum across the country and really across the world in creating these longitudinal databases. And as we think about tissue, we need to highlight and put forward the placenta. So you've heard about that over and over, placenta as great communicator, placenta as the translational organ going from mother to child. We need to be really intentional about assessing that. And then I'd like to just leave you with this. The potential power of epigenetic science is understanding what we can do today to affect the health of future generations, as well as what we can do today to mitigate or modify the effects on this generation. So I'd like to thank again our sponsors, USDA, the Robert Wood Johnson Foundation, the American Academy of Pediatrics. I'd like to thank the Institute of Medicine Board of Children, Youth, and Families in Kimber Bogard, Board of Nutrition, Food and Nutrition, and Ann Yachtine, as well as the Planning Committee, the speakers, and you all for your engagement throughout this process. I ended yesterday's session with a quote from T.S. Eliot, and I will bring it back to you, that in our beginning is our end. This is the end of our workshop, but it is the beginning of how we take these ideas and move it forward. Thank you all very much.